students, this session will be covering a bacteria called Clostridium tetani. So the Clostridium group involves many important bacteria like Clostridium tetani, Clostridium welchii, and Clostridium botulinum and difficile. So this will be dealing with tetany, which causes the very important disease of mankind, that is tetanus. So there were many questions asked from this part for the previous question university papers, that is like morphology of Clostridium tetani. It's a frequently asked question. An essay question is repeatedly asked on morphology, cultural characteristics, pathogenesis, laboratory diagnosis, and prophylaxis of Clostridium tetani. So when we say about Clostridium tetani, it's actually, it's a gram-positive bacilli like the other Clostridia, and they are spore-forming. All the Clostridia are spore-forming bacteria, and they are anaerobic. They can't survive in the presence of oxygen, and they are widely distributed in soil and also intestine of man and animals. So you call them as ubiquitous. Ubiquitous means they are present everywhere in the environment. So it's a causative agent for tetanus. They are obligate anaerobe. So coming to the morphology, it's a gram-positive bacilli bearing spore. It's a very slender bacilli, and the spore, it is present at the end of the bacilli and it is spherical in shape. So you call it a spherical terminal spore. So this gives the bacilli, it looks like this, no? So it gives the bacilli a drumstick appearance. The spore is at the end of the bacilli. So the characteristic morphology of Clostridium tetani, drumstick appearance. In addition to this, it doesn't have any capsule like perfringens, and it is motile with peritrichate flagella. So these are the points that you should remember regarding morphology of Clostridium tetani. It's gram-positive, it's a slender bacillus, and where does the spore occur? Spore occurs at the end or the terminal end of the bacilli, which gives it a characteristic drumstick appearance, and it is motile with peritrichate flagella. So that is the morphology. Now, when you say about how this particular bacteria causes the disease tetanus, that is what we mean by pathogenesis, no? So when we say about the pathogenesis of Clostridium tetani, the very important thing is its virulence factor. So virulence factor in tetanus, it is a toxin. So Clostridium tetani is one of the very important bacteria which produces a toxin. You can remember here what are the other toxin producing bacteria. Curine bacterium diphtheria, which produces diphtheria toxin. Then Bacillus anthracis, they produces toxin. So those are all toxin producing bacteria. So here toxin is very important for tetany. There are two types of toxins which are produced by Clostridium tetani, tetanolysin and tetanospasmin. So tetanolysin, it is actually a hemolysin which will lyse the RBCs, and it can produce hemolytic colonies on blood agar, and it acts as a leukotoxin also. It can destroy WBCs also, not only RBC. And when you say about the resistance or stability level of the toxin, tetanolysin, it is lysin, no? So it's very labile. It's labile to heat, and also it is labile to oxygen. It cannot withstand higher temperatures. It cannot withstand higher oxygen, presence of oxygen. Whereas tetanospasmin, the word itself indicates spasm. So tetanus is a disease which produces a lot of spasms. It is a neurotoxin. How can a particular thing cause spasm, muscle spasm? It has to involve the nervous system. So it is a neurotoxin. So spasmin is comparatively a stable toxin. It is S, so it is more stable, and it is stable to what? It is stable to oxygen. Clostridium is an anaerobic bacteria. The toxins produced by Clostridia, like tetanolysin, it is oxygen labile. It cannot withstand oxygen. L4L, remember, lysin is labile. Just leave the heat part. We can just remember the oxygen part. And for tetanospasmin is oxygen stable. So it can even be active in presence of oxygen. And what is the spasmin? Tetanospasmin, it is protein in nature. It's an exotoxin. And how does this tetany is able to produce the toxin? This property is derived by plasmid. It's a plasmid coded property, this toxin production. It's a very powerful neurotoxin. You can see how it acts in the mechanism of action. So all the effects which tetany produces is because of this toxin, neurotoxin, tetanospasmin. And what happens is, how does the disease occurs? Usually through contamination of wound, commonly following trauma, some accident or something. If the wound is contaminated with soil, dust, or animal feces, which is carrying the tetany spores, when the wound gets contaminated with tetany spores, what happens? The spore will germinate in the deeper wounds. When the spore enters the depth of the wound, when the presence of this foreign body is there, it provides a very low oxygen tension. Oxygen will be almost absent. In that situation, the spore will germinate, the vegetative bacteria will come out of the spore, and this will be strictly localized in the wound. The bacteria cannot invade the bloodstream. It is the toxin that is going to cause all the effects. So once this bacteria starts multiplying and produces the toxin, that is the tetanus toxin, you can see what happened. Tetanospasmin, where does it act? It actually acts at the inhibitory neurotransmitters. It prevents the release of the inhibitory neurotransmitters like GABA and glycine. You might have learned the inhibitory neurotransmitters are GABA and glycine. When these neurotransmitter release is blocked, what happens? There will be continuous stimulation by the excitatory transmitters. There won't be any kind of inhibition on the transmission of the nerve impulses, and this leads to increased excitatory nerve impulses, excitatory stimulation, leading to higher muscle spasms, rigidity, increased muscle tone, and all. So conditions like a reduced oxygen OR potential and devitalized tissues, the tissues when it's a very crush injury, when there are a lot of devitalization of the tissues, presence of foreign body like soil, dust and all, or cloth, all these helps in the germination of spore and toxin production. And what does this toxin acts? The toxin acts presynaptically and specifically block the synaptic inhibition in the spinal cord by blocking the release of the inhibitory neurotransmitters. So what does it act? It acts in the presynaptic manner. So due to this, because there is no control on the excitatory stimulus, excitatory signals, it leads to muscle rigidity and spasm. It is easy to remember. Tetanus produces tetanus toxin. Tetanus toxin, there are two types, of which most important one is tetanospasmin. It is, the name itself says spasm, so it causes all kind of spasms due to simultaneous contraction of the agonist and antagonist. There is no inhibition, so agonist muscles and antagonist muscles will contract simultaneously, leading to muscle spasms and rigidity. So the different features in tetanus: in the beginning, the patient can have some fever, higher blood pressure, then come to muscle spasms. And where does the spasm start? It will start in the masseters, the muscles. It will cause lockjaw. It will be very hard to close the mouth. It's called lockjaw, and it can lead to increased sweating and difficulty in swallowing. When it involves the other muscles, there can be difficulty in swallowing, difficulty in talking and all. And basically it starts with lockjaw because of the increased tone of the masseters. And there is a condition where the patient has very high difficulty to close the mouth. It will be like a grinning position. You call it as rhizus sardonicus. And so coming to the laboratory diagnosis of tetany, diagnosis of tetanus should always be made clinically. Lab diagnosis comes only secondary. The first thing is clinical diagnosis of tetany, and lab tests are just for confirmation. So what can be the specimen that you can get to isolate this bacteria? It is the wound swab, exudate, or tissue from the wound. Basically it's contaminating the wound, so you have to get the specimen from the wound. It can be swab, but swab is a bad specimen. You have to better go for exudate or tissue specimen. So what will you do with the specimen? First of all, you can do a gram staining. So when you do gram staining, what will you see? This is the exact appearance of the bacilli as how we see in laboratory. Gram positive bacilli with terminal round spores. So it will be like this, terminal round spore. What do you call that? It's called the drumstick appearance. Now we know this is an obligate anaerobic. It cannot grow in the presence of oxygen. So you need anaerobic culture media. And the very good anaerobic culture media that we have in our laboratories are Robertson cooked meat broth. It's a broth. It's a liquid medium which contains suspended meat particles. It's a minced cooked meat which is present in this medium. And this meat, it will be having reducing substances which will remove the oxygen present in the broth. So you add the sample to the Robertson cooked meat broth and you put a layer of oil or paraffin over the broth so that no more oxygen diffuses into the medium. Otherwise, you have other medium like thioglycolate broth. So please remember the anaerobic culture media, Robertson cooked meat broth, which is very important. Thioglycolate broth. You can also use blood agar, but you have to incubate it. You have to keep it in an anaerobic condition. That is what you need. So you may have to use a Macintosh fills jar or anaerobic gas packs may be required. And how does the colonies look like? This is how the colonies appear. So in RCM, in Robertson cooked meat broth, it will be like this. You have a tube which contains this meat particles, and here you will be having the liquid part, the broth. And what happens when the bacteria grows in this? The broth will become turbid and the meat will become black in color. Why the meat turns black? It is because tetany has got a proteolytic action. Since it lyses the proteins, it makes the meat black in color. And for blood agar, to make it more anaerobic, you can add polymyxin B to blood agar. So it will be a very good anaerobic medium. And you will see swarming kind of growth in blood agar. Why swarming? Because this bacteria is motile. So it will produce some concentric circles around it. Now coming to the prophylaxis. So laboratory diagnosis, please be thorough. It's very simple. Gram staining showing drumstick appearance, gram positive bacilli. Culture, please remember the anaerobic culture media, Robertson cooked meat broth and thioglycolate broth. We can also use a blood agar, but you have to incubate it anaerobically. So RCM, what happens to RCM when tetany grows? It will make the meat particles black in color with turbidity of the broth. Now what are you going to do to prevent tetanus? Suppose a patient is having a wound, a very bad crush injury, which is contaminated with soil and you call it as a contaminated wound. No? If such a wound happens, we have to take precaution that the tetany spores, if suppose they are present, they should not cause any harm to the patient. For that, you have to take some prophylaxis, which includes both surgical prophylaxis, antibiotics, vaccine, and immunoglobulins comes to play. So, for surgical thing, what you have to do, you have to debride the wound thoroughly, thorough wound debridement. That means you have to remove all the devitalized tissue, you have to remove the foreign bodies, blood clots, everything which can lead to a very low oxygen tension, oxygen potential, OR potential. You have to remove all those things. That is very important. After that, antibiotics come, like metronidazole or penicillin can be given. Metronidazole is very good for anaerobic bacteria. What does this antibiotics do? It will destroy any bacteria which is present in the wound. If already there is toxin production, antibiotic cannot do anything. So you have to start antibiotics immediately. Now, then comes the active, passive, and combined immunization. I've told you combined immunization or prophylaxis means you are giving both active immunization and passive. Tetanus is one condition where you need a combined immunization. So what will you give for active immunization? We know the very famous vaccine TT, tetanus toxoid. All of us go for a TT vaccine when we have a wound with a very bad metallic object. No, so TT is a toxoid vaccine. You remember it is a bacterial subunit vaccine because this bacteria produces toxin. You can weaken the toxin, that is, you can make it weaker so that it won't cause disease, but it will produce antibodies. So you have made a toxoid from the toxin and that is being used as the vaccine. And how do you make the toxoid? We are using formalin for that. That's why it's called as 4-mol toxoid. And how you give this TT vaccine as part of the national immunization schedule is we give it along with 4 other vaccines. So you call it as a pentavalent vaccine. For children, we give a single shot which contains all the 5 vaccines. DPT, that is diphtheria, pertussis, and tetanus, along with hepatitis B and Haemophilus influenza B vaccine. Together, you give them intramuscularly. And when do you give them? First 3 doses at 6, 10, and 14 weeks. And you give 2 booster doses at 16 to 24 weeks. That is just 16 to 24 so not weeks, 16 to 24 months. It's 16 to 24 months and then 5 years. This is how we give the booster doses. So 6 and 14 weeks, you give 3 doses. Then you give a first booster at 16 to 24 months and the second booster at 5 years. So 5 doses are required for completing the primary immunization of tetanus toxoid vaccine. Now that's not enough with that. Then you give boosters at 10 years and also at 16 years. So after 5 years, you give boosters at 10 years and 16 years. Suppose if it's an adult who is coming who have not taken this childhood vaccination, you have to give 4 doses of TT and that should be given for adults for complete immunization. You have to give 4 doses. In addition to this, if they sustain a bad injury, if the last dose of TT is more than 5 years, then you have to repeat the vaccine. You have to give the boosters. And also sometimes if the wound is contaminated, they may require antibodies or tetanus serum is required. So anti-tetanus serum is the serum which is derived from most probably we take an equine serum, equine anti-tetanus serum. We inject the tetanus toxin into a host, and you derive the serum from the host, which contains a lot of anti-tetanus immunoglobulins, and this is being used. So there is both equine as well as human immunoglobulins available. Why the problem with the equine thing is it can lead to serum sickness and other reactions. So we go for human immunoglobulin, and the dose we give is 1500 international units in intramuscular route after the person is wounded. This is particularly required if the person is not previously vaccinated and their wound is very bad contaminated wound. That is when we go for a passive immunization. So this is also important for prevention of tetanus. So in a non-immune person, what you give is you give a combined immunization. So what you do, you immunize with the first dose of TT vaccine in one side, along with administration of the anti-tetanus serum or human tetanus immunoglobulin on the other arm. So simultaneously, you're giving the vaccine or active immunization and antibody, that is a passive immunization. And after that, you have to complete the vaccine schedule. The other 3 doses also should be administered after that. Now, how will you treat a patient who has developed tetanus? Spasm is the main problem. They will be having painful spasms. So you have to control the spasm, maintain the airway, because laryngeal obstruction is a very common thing which leads to death. So you may have to do a tracheostomy, and you have to attend to feeding. Then antitoxin should be given to neutralize any toxin present. You have to administer the antitoxin. Antibiotic therapy should be initiated, and tetanus patients are actually treated in special isolated units because any kind of stimulus can precipitate the spasms. So they are being placed in a very quiet room. Even noise and air can precipitate spasms. So that is how we treat tetanus patients, and the wound should be thoroughly debrided, and everything should be clean, foreign body, revitalized tissue, everything should be removed. So because of this very good immunization program in our country, the tetanus cases are very low now. So we are no more much worried about this particular disease, but still is a very important disease. And please once more note the previous year question, which can be asked as an essay question also. And that's a very important topic. Thank you.